Welcome to the North of England Cancer Network's first vidcast. My name's Roy McLachlan and I'm the network's director, and I'm here to tell you about a national campaign on early awareness of bowel cancer being planned for the end of January 2012. This webcast aims to give you the key information about the campaign to help you plan within your own organisation and be prepared for increased number of patients. I hope you find it useful. How do we put this campaign into the wider policy context? Two specific documents come to mind: the Operating Framework for the NHS and Improving Outcomes, a Strategy for Cancer 2011. These documents frame the campaign in terms of improving survival from cancer by earlier presentation and earlier access to diagnostics for patients suspected of having cancer. The 2011 strategy charges cancer healthcare teams and organisations with saving an additional 5,000 lives, and the North of England Cancer Network has recently committed to saving 1,000 lives in order to improve the network position in relation to national and European mortality rates. Last January, just as the 2011 strategy was being published, we received an updated 3-year analysis which compares our progress in improving mortality rates in cancer with the actual England average. This slide on the screen shows the relative positions of each cancer network in relation to the level of change in mortality rates since 1997. This is represented by the vertical line moving from smaller percentage change to larger percent change on the right. The horizontal line is the England average, and therefore networks really want to be in the top right-hand quadrant. The North of England Cancer Network has shown a high level of improvement change in mortality rates, but remains below the England average. As this next slide demonstrates, only by saving an additional 1,000 lives does the North of England move into the higher performing quadrant. One of the first questions often asked is, why do we need a national campaign? Nationally, bowel cancer is one of the biggest cancer killers, and it follows that this is a tumour site where there is considerable scope for improvement in outcomes. It's important to note that over 90% of bowel cancer patients diagnosed with the earliest stage of disease survive 5 years from diagnosis, compared with only 6.6% of those diagnosed with advanced disease. It's estimated that 1,700 deaths could be avoided each year if our bowel cancer survival rates were as good as the best in Europe. At a national level and a local level, later diagnosis is seen as a key reason for the poorer survival rates. Late presentation is seen as a real barrier to survival, and research has been done locally using the Cancer Awareness Measure survey, qualitative research carried out with the public. The insights we gained from the local survey confirmed the national view that the public has a low level of knowledge about the symptoms of bowel cancer and are reluctant to present if they do have symptoms. People say they don't want to waste the doctor's time or that they're too embarrassed. So the challenge is to raise people's awareness of the signs and symptoms and to encourage them to see their GP earlier, and to get the message across that finding symptoms of cancer earlier enough makes it more treatable and could save your life. Pilot campaigns were run in 2 regions earlier in 2011, and we have some analysis of those campaigns. This slide shows how the public awareness of cancer signs and symptoms changed and in fact was raised after the campaigns in the South West following the bowel cancer awareness pilots. We can see the before in green and the after in blue. It's worth noting the second point in relation to blood and the 5th point on loose stool movements. We can also see the last point on don't know is much reduced. Similar results were reported in the East of England pilot. Another popular question is, how will the increased activity be funded? The NHS Operating Framework for 2011-12 included investment in diagnostics for 4 modalities: chest X-ray, ultrasound, MRI and endoscopy. Funding has been indicated at over £400 million for a 4-year period, from £33 million in the current financial year to £198 million in 2014-15. The national campaign will start on 30th of January 2012 and run to the end of March, and is the Be Clear on Cancer campaign materials which you'll have seen from our previous campaigns. The campaign will include a national TV advert, national magazines such as TV Times and women's magazines, on billboards and on radio. Across the north of England, we'll be supporting the campaign through the local media with patients and real-life survivor stories, as well as providing resource packs to support GPs. The campaign is designed to promote 3 main objectives: to give simple information about bowel cancer symptoms, to provide a clear call to action to see the doctor, to give a reassuring message to the public that finding symptoms earlier makes cancer more treatable and could save your life. The campaign will be aimed at people over the age of 55, and as shown in this slide, the key message is: if you've had loose poo or blood in your poo for more than 3 weeks, then see your GP. This message has been developed with a range of key stakeholders and was successfully trialled in the 2 pilots earlier last year. You'll have noticed it uses 3 weeks as a timescale, which is earlier than the NICE guidelines for urgent GP referrals for suspected bowel cancer, which state 6 weeks. The reason for this is the national team are keen to ensure that people with potentially serious symptoms go and see their GP promptly, with the expectation that GPs will, of course, continue to exercise their clinical judgment about the appropriate pathway for individual patients, recognising that the great majority of those presenting and referred on to secondary care will not have bowel cancer. It's expected that this national awareness campaign will create an increased demand for diagnostic services shortly after the campaign starts. Lower GI endoscopy is the primary diagnostic tool, and it would be reasonable to assume endoscopy services across the network will experience an increase in demand following the start of the campaign. So what sort of impact are we expecting? To anticipate the impact, the network has reviewed the available outcomes from the 2 pilot campaigns, which were based in East of England and South West England and took place in January 2011 for 7 weeks. The results of the pilots suggest primary care should anticipate a manageable increase in the number of patients presenting with relevant symptoms, and can expect an increase of 1 extra patient referral per week per practice from the start of the campaign. Secondary care should anticipate a marked increase in GP referrals for suspected lower GI cancer, as the pilot sites showed a peak 4 weeks into the campaign, then a moderate decline, but in some trusts referrals did not go back to pre-campaign levels. The pilots did report on the percentage increase in referrals experienced by the trusts. However, they recorded a broad spectrum of increase from 32% to 100%. Therefore, the network has suggested a 50% increase would be a reasonable assumption, and a modelling tool has been shared with network colleagues should they wish to use it. To support GPs, we will be providing materials that have been developed by Bowel Cancer UK. They provided information for the pilots, and they're now revising this to take account of feedback. Cancer Research UK is working with doctors.net on producing practical resources for clinicians on cancer and early diagnosis. The National Cancer Action Team, with the support of cancer networks, will be making a risk assessment tool for colorectal cancer available for wider dissemination and use in the new year. We'll be pooling all these resources and sending them out to primary care. Finally, I hope this vidcast has given you a good overview of the rationale behind the National Bowel Campaign and gives you a feel for the likely impact locally. I'd also like to thank you for your continued support and enthusiasm to help improve the number of people in the north of England who recognise early signs and symptoms of cancer and go to see their GP. Please look out for further updates via emails and bulletins. Thank you very much.